Welcome to this CNBC Africa special. I'm Chris Bishop. Now, without doubt, COVID-19 has caused havoc across the continent. The only question now is how much havoc has it caused and what are African nations doing about it? Now, with me on the line here, we have a man who works with 33 countries across Africa, and he can tell us just that and what's being done about it. I'm speaking to Junior Ngulube, the Vice Chairman of Sanlam Pan-Africa. He joins me for more. As I said in the intro, you work in 33 countries across Africa. Just give us an idea of which countries are the worst hit right now.
Thank you very much, Chris, and good afternoon to your viewers. Yes, indeed, we are operating in 33 countries outside of South Africa. And in terms of the incidence of COVID, the top three countries in terms of numbers is South Africa. I think we're sitting at 37,000. Egypt, Morocco, and to some extent Ghana as well. This is in terms of the numbers. But also one cannot look at just the numbers in terms of the incidents, but one also has to look at the readiness of the various countries before this incident. This talks mainly to the economic health of the countries, the state that they were in, and one can group them into those countries that are resource dependent. If you look at the oil exporters, for example, the economic impact was a little bit more severe. You're talking Nigeria and Angola, to some extent Ghana. And then you've got other mineral dependent economies, your Zambia, your Botswana with diamonds. And then the more resilient, let's say, diversified economies, your Kenya, your Ethiopia, they had a bit more stable economies. And then one can also look at those countries that were already challenged economically before these incidents. And here I would look at situations like South Sudan and our northern neighbor, Zimbabwe. So the ability to respond, in a way, was also related to the economic readiness.
And
in terms of the response, yes, Chris.
No, sorry. Something you may have seen is a build-up of the kind of infrastructure. I mean, I remember when COVID-19 first broke out on the continent, talking to the World Health Organization, and they said there was only a handful of countries that could actually test for COVID-19, and now they're proud to say there's more than 40. So you must have seen that build-up across the continent. Just give us some idea of what's been happening on the ground.
Yes, in terms of the readiness to test and the responses themselves, they were quite varied, Chris. I think first off the block was Ghana, which went with a hard lockdown, followed by testing. And I remember their president saying, we know how to bring back economies to life, but we do not know how to bring human beings to life. And that was followed by a hard lockdown and testing. But interestingly, sometime later, they opted to open up their main economic hubs of Kumasi and Accra. And one saw this picture also in Nigeria because of the experience I think they had in 2014 with the Ebola outbreak. They were very quick in establishing isolation clinics with testing. And this picture repeated itself in a number of countries. But we also had, let's call them outliers. For example, in the Tanzanian government opted not to lock down because they took a view that their economy is highly informal and locking people down would have disastrous effect in terms of livelihoods. And I think another unique response we saw was in Madagascar, where I haven't seen the scientific evidence, but they have come up as announced with a treatment of their own. So the responses have been varied, but I think what has been common, Chris, is the shortage of materials. And here we're talking of testing kits, we're talking of PPEs, we're talking of these remote handheld thermometers to check people's temperatures. And this was bound to be the case in any event, because many of our health facilities in many countries were not in their best shape coming into the outbreak.
And also, again, something else that was raised by the World Health Organization during this pandemic was the fact that a lot of places in Africa, it was very difficult when it comes to business to do social distancing. I mean, you and I know, we've both been there. You go to markets on this continent, people are mixing together, otherwise no business is done.
Absolutely. This is where the practicalities come into place. If you look at economies or countries with a fairly large formal business sector, I can use South Africa as an example here, it could be, and it was possible to a good degree, to exercise social distancing, of course, under supervision. But then when you do that, you also need to support the population in terms of food supplies and the like. But a lot of our economies are informal. People make their living by buying and selling mainly in the streets and in the markets. We've got massive markets on the continent. If you look at in Lagos, we've got Oshodi market. It's a massive market. And there it's virtually impossible to talk of social distancing of any manner. And this varies from country to country because of the high degree of presence of the informal sector in terms of the market, as well as the small businesses. Yeah.
What about the formal sector? From what you're picking up from the 33 countries you work in across the continent, what changes are they going to have to make in this so-called new normal that we're going to face?
I think this is where we are going to have to be really innovative, because the consumer is experiencing changes that even us as business people are going to take some time to understand. Firstly, at a personal level, and secondly, in terms of their preferences. People have lost income. People wanting to save the little money they've got, and their choices are going to change because of the change in circumstances in terms of social distancing, lack of traveling. Our sales force, for example, is no longer able to visit their clients and sit across the desk and give advice. How do you, in that circumstance, interact and sell your products?
What are you going to...
When I speak of...
No, I mean, what are you going to do? There's a question I have, is the fact that maybe back in the day, you know, or not too long ago, you'd phone someone up if you wanted to come and have financial advice. They come to your house. Or what about places in the continent, which there are very, very many, where there isn't any bandwidth, there isn't any infrastructure, so you can talk to people? What are you going to do there? How are you going to get to people?
Yes, we have actually, fortunately, I suppose this applies to other businesses. We have been developing quite a number of digital channels. If I look at our bank assurance partners, with them, we've been developing even mobile-based or internet-based access to their products, well, Sanlam products through the bank channel. And what this does is it makes us actually speed up the development of those channels. And believe it or not, the penetration of mobile, of cell phones on the continent is probably one of the highest per capita in the world as we speak, because we didn't have a lot of landlines before. So that channel is there. We and other business people now need to ramp up how to utilize it. We see it in the mobile money, and it also opens up opportunities to distribute insurance products. And I'm sure other service providers will be looking to the same. So digitalization, or the digital channel, is really coming to the fore here. and businesses have to really step up their game when it comes to digitization, Chris.
Who do you think is going to survive the post-COVID world? What kind of businesses do you think are going to be on the front foot?
It's going to really boil down to two things, Chris. And the first one is speed. Because this thing came at us very suddenly, and we all hitting the starting blocks as we reopen our businesses right across the continent. Whoever is going to be quick in getting at least a minimum number of their people back in action, giving them the tools, and that means working remotely. But the bottom line is being quick to achieve this connectivity with your clients, enabling your workforce to be connected. That speed or the agility is what is going to separate the winners from the losers going forward. And then, of course, it also talks to your own organization itself in terms of your staff. How motivated and enabled are they to take on this new challenge? What are you doing in terms of incentivization to make sure that they adapt quickly to this new circumstance? I would say agility and speed is going to be the key.
Thank you very much indeed. That was Junior Ngulube, the Vice Chairman of Sanlam Pan Africa, on his company's fight across 33 countries in Africa in the face of the COVID-19 pandemic. I'm afraid that's all we've got time for on this CNBC Africa special. From me, Chris Bishop, and the team is goodbye. Do stay tuned afterwards. West Africa is coming right up. Do stay with us.